Today, we're diving deep into understanding blood cancers, their signs, symptoms, and a range of treatment options. Stay tuned as we explore the fascinating realm of natural remedies and alternative treatments that can help ease the symptoms of leukemia. Whether you're seeking information for yourself or a loved one, this video is packed with valuable insights. If you're ready to learn and engage with important health topics, hit that subscribe button and join us on this enlightening ride. Let's get started. Your blood, which accounts for about 8% of your normal body weight, plays an important role in how your body functions. As your blood circulates throughout your vascular system, it supplies all of your organs with oxygen, nutrients, hormones, and antibodies. Blood is made of an almost equal mix of plasma, the liquid that transports cells, waste, and nutrients, among other things, and blood cells, red blood cells, white blood cells, and platelets. Number 1. Acupuncture. Acupuncture is a traditional remedy that can help people manage the side effects of cancer treatments, such as chemotherapy. The remedy involves placing thin needles into pressure points around the body. The National Center for Complementary and Integrative Health, NCCIH, states that this can stimulate the brain to reduce pain. According to the National Cancer Institute, some clinical trials have found acupuncture can relieve nausea and vomiting as a side effect of chemotherapy. It may also reduce pain, fatigue, and dry mouth, as well as relieve symptoms of insomnia, anxiety, or depression. Number 2. Essential oils. Essential oils are compounds from plants that people combine with a carrier oil to treat various ailments. According to the National Cancer Institute, NCI, essential oils may help some people with leukemia manage certain side effects of chemotherapy, such as tiredness or changes in appetite. Number 3. Auricular acupressure. Auricular acupressure is a treatment that uses magnetized pellets or seeds to stimulate areas of the ear. Another 2021 study also showed that auricular acupressure could help people living with cancer sleep better, even while undergoing treatment. On the other hand, another 2018 review found only weak evidence that the treatment could relieve constipation in people with leukemia undergoing chemotherapy. Herbal products. The NCI states that no herbal products can treat or cure cancer, but some may help with certain side effects of treatment. Number 1. Turmeric. Researchers have explored whether turmeric may be helpful for people with leukemia. The active ingredient of turmeric is curcumin, which has anti-inflammatory properties. One 2017 review suggests that curcumin could be beneficial for people with leukemia when a person uses it alongside conventional treatment. According to the review, curcumin has anti-tumor properties and can help treatments slow disease progression, reducing the doses of medical treatments necessary and lowering the risk of side effects. However, the review provides no evidence that curcumin can actually cure cancer without other medical interventions. Furthermore, the review adds that there are no clinical trials on the safety of high curcumin doses and more research is necessary to assess this. Number 2. Ginseng. Ginseng is a plant that people use worldwide as a natural remedy for several ailments. The active ingredients in ginseng are ginsenosides. Some test tube studies report that ginsenosides may have anti-tumor properties. One 2020 study suggests that combining chemotherapy with compound K, another substance in ginseng, may be beneficial for the treatment of leukemia. However, none of these studies prove definitively that ginseng or the compounds it contains can cure leukemia when a person uses them without medical treatments such as chemotherapy. Additionally, more studies on humans are needed as research is currently limited to test tube studies using highly concentrated amounts of ginseng and its components. Nutritional supplements and vitamins. A healthy diet can help support the body of a person who has leukemia. It will not cure or treat the condition but may keep the body in better shape to fight the disease and manage symptoms. The majority of supplements simply ensure the body has enough vitamins and minerals to function properly. However, some in vitro studies have shown that vitamin C can have an anti-tumor effect. One 2017 rodent study suggests that injecting very high doses of vitamin C can kill leukemia cells. Some studies suggest the possibility of using vitamin C to enhance the work of chemotherapy or other treatments. However, scientists do not currently recommend using it in humans for this purpose. Detoxification therapies. Detoxification, or detox, therapy is the name for diets, regimens, and therapies that claim to remove toxins from the body and promote health. For example, it can include fasting or using a sauna. However, the human body already has an effective system for removing toxins. Detoxification therapy is unlikely to benefit most people, including those with leukemia. Homeopathic medicines. According to the NCCIH, Homeopathy is an approach to medicine that stems from two unconventional theories, neither of which has the backing of research. The theory that like cures like refers to the idea that a person can cure a condition by taking substances that produce similar symptoms in people without the condition. The law of minimum dose suggests that lower doses of medication are more effective than higher doses. People who make homeopathic products often dilute them to the extent that they contain no active ingredients. Not only is there no scientific evidence to support either of these theories, but the NCCIH warns people against using homeopathy to replace established treatments, as this could worsen symptoms and allow the disease to progress. Medical treatment. Treatment options for leukemia vary and depend on several factors, including the type of leukemia, the person's age, the person's overall health. Common treatments for leukemia include: Number 1. Chemotherapy. Chemotherapy means using cell-killing drugs to destroy cancer cells. Chemotherapy is often given directly into a vein. The drugs can travel around the body in the bloodstream and kill the cancer cells. This is called intravenous, for chemotherapy. It's also called having an infusion, a drip. Usually, the chemotherapy is in a bag of fluid with a tube coming from it that goes into a vein in your hand, arm, or chest. It can take several hours to receive chemotherapy into a vein in this way, or sometimes more than a day. Many people have chemotherapy as an outpatient. That means you come to hospital for treatment and can go home again afterwards. Chemotherapy can also be given as tablets, sometimes as a course of treatment, or sometimes as a more long-term treatment. Chemotherapy is often given in cycles. A cycle includes having some chemotherapy and then having a rest period with no treatment. For example, you may have chemotherapy once a day for 5 days and then have 3 weeks with no treatment. This is one cycle. The number of cycles you have and what they involve will depend on the type of blood cancer and drugs you are having. Whilst chemotherapy can kill cancer cells, it also damages healthy cells in your body. This is what causes the side effects of chemotherapy. Number 2. Stem cell transplant. A stem cell transplant means replacing the stem cells in your body with new, healthy stem cells. Stem cells are cells at an early stage of development. All blood cells start off as stem cells in the bone marrow. Blood cancer happens when something goes wrong with the development of your blood cells and they become cancerous. A stem cell transplant can be a treatment for some blood cancers because it involves destroying the abnormal stem cells that are producing cancerous blood cells and giving your body new, healthy stem cells that can make healthy blood cells again. This involves having high doses of chemotherapy to destroy your existing stem cells and then having the transplant to replenish your bone marrow with healthy stem cells. A stem cell transplant is also used to replace your stem cells if you need high doses of chemotherapy to treat your blood cancer, which as a result damages your bone marrow and stem cells. There are 2 types of stem cell transplant: autograft/autologous, where your own stem cells are collected and stored and given back to you later by transplant; allograft/allogeneic, where someone else's stem cells, donors, are used for the transplant. The way the cells are given to you during the transplant is into your vein, in a similar way to having chemotherapy or a blood transfusion. Number 3. Radiotherapy. Radiotherapy uses high-energy rays, such as X-rays, to destroy cancer cells. It can be used to treat Hodgkin lymphoma or non-Hodgkin lymphoma. The rays are aimed at the part of the body where the cancer cells are, for example, particular groups of lymph nodes. During treatment, you will lie on a flat surface with the radiotherapy machine above you. You will not feel anything during the treatment, but high-energy rays will be aimed at the part of your body being treated. This will damage the cancer cells in the area being targeted. You will normally have to visit the hospital daily to receive your treatment and then go home afterwards. It may take several weeks to complete a course of radiotherapy. Number 4. Immunotherapy. Immunotherapy is a way of treating cancer that uses your own immune system to attack the cancer. Any cancer treatment that harnesses the immune system to help it work can be classed as an immunotherapy. Some immunotherapy drugs work by triggering your body's own immune system to find and kill cancer cells. The drug attaches itself to a cancer cell, which makes the cancer cell easier to find for your immune system. Your immune system then attacks the cancer cell. An example of an immunotherapy drug that works like this is rituximab. An example of advanced immunotherapy is CAR-T therapy, where your own T cells, a type of white blood cell that normally fights infection in the body, are genetically modified to boost their ability to find and kill cancer cells. Alternative cancer treatment. Alternative cancer treatments can't cure your cancer, but they may provide some relief from signs and symptoms. Number 1. Exercise. Exercise may help you manage signs and symptoms during and after cancer treatment. Gentle exercise may help relieve fatigue and stress and help you sleep better. Many studies now show that an exercise program may help people with cancer live longer and improve their overall quality of life. If you haven't already been exercising regularly, check with your provider before you begin an exercise program. Start slowly, adding more exercise as you go. Aim to work your way up to at least 30 minutes of exercise most days of the week. Number 2. Hypnosis. Hypnosis is a deep state of concentration. During a hypnotherapy session, a therapist may hypnotize you by talking in a gentle voice and helping you relax. The therapist will then help you focus on goals, such as controlling your pain and reducing your stress. Hypnosis may be helpful for people with cancer who are experiencing anxiety, pain, and stress. It may also help prevent anticipatory nausea and vomiting that can occur if chemotherapy has made you sick in the past. When performed by a certified therapist, hypnosis is safe. But tell your therapist if you have a history of mental illness. Number 3. Massage. During a massage, your practitioner needs your skin, muscles, and tendons in an effort to relieve muscle tension and stress and promote relaxation. Several massage methods exist. Massage can be light and gentle, or it can be deep with more pressure. Studies have found that massage can be helpful in relieving pain in people with cancer. It may also help relieve anxiety, fatigue, and stress. Massage can be safe if you work with a knowledgeable massage therapist. Many cancer centers have massage therapists on staff, where your provider can refer you to a massage therapist who regularly works with people who have cancer. Don't have a massage if your blood counts are very low. Ask the massage therapist to avoid massaging near surgical scars, radiation treatment areas, or tumors. If you have cancer in your bones or other bone diseases, such as osteoporosis, ask the massage therapist to use light pressure rather than deep massage. Number 4. Meditation. Meditation is a state of deep concentration when you focus your mind on one image, sound, or idea, such as a positive thought. When meditating, you might also do deep breathing or relaxation exercises. Meditation may help people with cancer by relieving anxiety and stress and improving mood. Meditation is generally safe. You can meditate on your own for a few minutes once or twice a day, or you can take a class with an instructor. There are also many online courses and apps available for guided meditations. Number 5. Music therapy. During music therapy sessions, you might listen to music, play instruments, sing songs, or write lyrics. A trained music therapist may lead you through activities designed to meet your specific needs, or you may participate in music therapy in a group setting. Music therapy may help relieve pain, control nausea and vomiting, and deal with anxiety and stress. Music therapy is safe and doesn't require any musical talent to participate. Many medical centers have certified music therapists on staff. Number 6. Relaxation techniques. Relaxation techniques are ways of focusing your attention on calming your mind and relaxing your muscles. Relaxation techniques might include activities such as visualization exercises or progressive muscle relaxation. Relaxation techniques may be helpful in relieving anxiety and fatigue. They may also help people with cancer sleep better. Relaxation techniques are safe. Typically, a therapist leads you through these exercises, and eventually you may be able to do them on your own or with the help of guided relaxation recordings. Number 7. Tai Chi is a form of exercise that incorporates gentle movements and deep breathing. Tai Chi can be led by an instructor, or you can learn Tai Chi on your own following books or videos. Practicing Tai Chi may help relieve stress. Tai Chi is generally safe. The slow movements of Tai Chi don't require great physical strength, and the exercises can be easily adapted to your own abilities. Still, talk to your provider before beginning Tai Chi. Don't do any Tai Chi moves that cause pain. Number 8. Yoga combines stretching exercises with deep breathing. During a yoga session, you position your body in various poses that require bending, twisting, and stretching. There are many types of yoga, each with its own variations. Yoga may provide some stress relief for people with cancer. Yoga has also been shown to improve sleep and reduce fatigue. Before beginning a yoga class, ask your provider to recommend an instructor who regularly works with people with health concerns, such as cancer. Avoid yoga poses that cause pain. A good instructor can give you alternative poses that are safe for you. Thank you for taking the time to watch this comprehensive video discussing blood, its vital role in the body, and important insights into blood cancers and their treatments. Knowledge is a powerful tool when it comes to managing our health, and we hope this information has been both informative and helpful to you. If you found this video valuable, please consider giving it a thumbs up and sharing it with your friends and family. Spreading awareness about blood cancers and the available treatment options is essential in our fight against these diseases. Don't forget to subscribe to our channel for more in-depth content on health and wellness. By subscribing, you'll stay updated with the latest information and discoveries in the field of medicine. We value your feedback and questions, so please feel free to leave your comments below. Your input helps us tailor our content to your needs and interests. Remember, your health is precious, and being informed is the first step towards a healthier life. Stay tuned for our upcoming videos, and thank you for being a part of our community. Take care and stay well.